I've realized just in the 6-7 months that I've been out and during school that most people have no idea what pharmacists actually do. How many of you think pharmacists count pills, they count to 5 real fast, pour it in a bottle, and that's it? Anybody heard that? Hear that all the time. Count to 5 real fast, dispense it, that's it. So we're going to go through a couple different areas of pharmacy. It's very diverse. If you go to pharmacy school, you have a lot of different options of what career you can choose. I worked all the way through pharmacy school. Actually started when I was in high school, my last semester, working as a clerk for Dillon's Pharmacy on 30th Street. Went to JUCO, went up to KU, continued working at Dillon's Pharmacy. So I worked all the way through. So mainly my experience, besides school and all the rotations and everything, which we'll talk about a little bit, is just retail pharmacy. Some things that people don't know that we do, a big part of our day is I hardly ever touch a pill. It's all clinical, making sure that the doctor is prescribing the right dose, making sure there's no interactions, making sure there's no allergies. So basically, really using the computer and the education that we have to make sure that there's no gaps in between what the doctor's prescribing and what they're getting when they come to the pharmacy. So part of that is medication therapy management, relatively new, starting to take hold. Everything's going towards this. 3 or 4 times a week, I have an appointment with a patient, maybe on 10 to 20 different drugs. They come in just like a doctor's appointment. If you're going to the doctor's office for an illness or something, they come in, we sit down, we go through every drug that they have, go through the way that you're supposed to take it. A lot of people, don't know different drugs need to be taken different ways. Some of them with food, some of them very important without food, times of the day, different things like that. So we'll go through and we'll talk about each one of their medications, make sure that they're doing okay on those. Suggest therapy changes to the doctor. Usually there's at least 1 or 2 every time I have an appointment where I'm calling the doctor saying, hey, maybe we need to switch this around to try to help that patient do a little bit better. So people really appreciate that because, you go for an appointment with the doctor, they might be in there for 30 minutes. They're super busy people. We'll talk about that a little bit, how healthcare professions are evolving and speeding up as far as we need more people going to those career paths. Then vaccinations. 10 years ago, people thought it was crazy to go to the pharmacy to get a vaccination. Now we do almost every vaccination. There's some vaccinations you can't even get at the doctor's office because your insurance won't cover it. You have to come to the pharmacy. So we do those all day. Right now it's flu season. Make sure everybody gets a flu shot. We probably do, 10 to 20 a day, and then we do off-site flu clinics. We'll go out into the community and do anywhere from 20 to 100 flu shots in a couple hours. Health screenings, really new concept for some people, but you can go into the pharmacy, get a health screening done, pay 20, 30 bucks, something like that, and we'll go through, take your blood pressure, we'll check your blood sugar, we'll run a lipid panel on you, check your cholesterol, all of that stuff, get those results back, and we'll send those to your doctor and say, hey, this person has a little bit high cholesterol, let's try starting them on this drug. And a lot of times they do take the recommendation. Sometimes they say, no, we want to see them in the office, and they'll set up an appointment. But we're not very far away from pharmacy being a place where basic things like strep throats, ear infection for little kids, cholesterol, stuff like that, blood pressure can be managed by a pharmacist. In Washington State, they already have prescriptive authority where you go to the pharmacy and they're going to prescribe you your drugs for cholesterol. And that, again, goes back to the shortage of healthcare professionals that we're having. And we'll get into that a little bit later. I already talked about interactions, dosing. A doctor prescribes an antibiotic for an 85-year-old woman who comes over, normal dose. We go through it and say, well, based on their age, kidney function is going to be a little less in this patient, so we'll do the calculation and it might be too high of a dose. So we'll call the doctor back, collaborate with them, change it, and get them on their way. But making sure that stuff is safe. Also making sure that, everything, technology has helped it, but there's errors that can happen anywhere. And one example is a couple months ago, I got a prescription for an antibiotic for a 2-year-old that was about triple the dose that it should have been. sent over by the nurse. They're super busy people. It just takes the wrong button on a computer. So that's another thing we're checking is when it comes through, we're making sure doses are right so we don't end up harming a patient. We had another example. We had a patient a year ago. I wasn't involved, but I've heard the story that the prescription was accidentally sent over for a blood pressure medication instead of a anxiety medication that sounds very similar. Wasn't caught by the pharmacist. That patient ended up getting an ambulance ride to the hospital because their blood pressure bottomed out and they passed out. So that's some of the things that we're looking for when we go through. And then a big part, like I said, is patient education. They come pick up the prescriptions. We're the one educating them on how to take the medication, when to take it, what to look out for, stuff like that. Hospital pharmacy, your last year of pharmacy school, every month they send you to a different pharmacy, different style of pharmacy, all over the state, out of state, everywhere, out of the country. Some people went out of the country. Hospital pharmacy is a little bit different, starting to evolve a little bit too, but order verification, verifying with the doctor, a lot of the same things in a different setting as retail pharmacy. There you get to do some of the rounding. I was on rotation at Hutch Regional a couple years ago and got to round every day with doctors. That was good. Little stressful. They're asking you questions all the time about medications. You go to medical school, you might get 2 semesters of pharmacology is about it. People don't realize that. I like to say the 3 parts of healthcare professions, you've got your nurses, your doctors, your pharmacists. Doctors are learning about your body, how to diagnose what's wrong with you, how to fix what's wrong with you. Nurses are giving care, taking care of you, and then the pharmacists are the ones that know all about those drugs. So it was not uncommon at all to be on rounding and doctors bouncing questions off you because they have no idea about certain drugs because they had to spend all their time on the different intricacies of the body. So that's pretty fun when you get to do that stuff. After pharmacy school, you can specialize. A lot of people go to residencies all over the country. People don't realize, around here we're a little bit smaller, but all the bigger hospitals, Wichita, Kansas City, any big city, go to a bigger hospital, there's going to be a pharmacist in the emergency room. That's their only job is emergency medicine. There's going to be pharmacists in ICU. They're going to be a pediatric pharmacist, cardiology, lipid clinics, and then obviously pharmacists have to go back and teach. So you can go back and be a college professor if you want to. So your choices are very, very varied. Emergency room pharmacy, I loved it when I was on rotation. I was done with school at that point. I didn't want to do another year or 2 to specialize. But when I was in Salina, we were required to respond to all code blues. So people don't realize that pharmacists get involved with that, but you got a room full of people, and the pharmacist is the one doing all the dosing, drawing up all the syringes. Someone's dying there, and you have a team together, and they have a very good spot in that teamwork to try to take care of that patient. So very interesting. Some of my classmates are going into that. It's an adrenaline rush for sure. It's high pressure. I liked it, but like I said, it's another year or 2 of getting paid, but not very well, to basically work and learn at the same time. So now that we have an understanding of kind of what a pharmacist does, it's not the basic, count by 5 real fast. We'll talk about why to choose the pharmacy profession. How many of you like math and science? Anybody? Math and science? Okay. Math and science, you have to like math and science, basically. I'm going to show you curriculum here in a little bit. Not a whole lot of math classes that you have to take. Definitely some of them, but almost your whole entire curriculum is going to be math. A lot of that science has a lot of math in it. So if you excel at math and science, if you enjoy it, that's what I liked in high school was math and science. Really any healthcare profession is going to be right for you when it comes to that stuff. Helping people and making a difference. You have to deal with a lot of people that are not very fun to deal with, but it makes it worth it because you have people come in that you find out what is wrong, something that they've been, dealing with for maybe a couple of years, and you figure out it's due to one of your medications, get it switched, and they are very, very grateful to you. Helping people with insurance. I hate insurance. I have to deal with insurance a lot. It's not very fun. But people are very appreciative because it is so confusing. you help them out with that and try to save them a little bit of money with their medications, and they're very appreciative. So you really can, every day, see that you are making a difference for some people. It's not always fun. Any job that you go into that you have to deal with the public, it's good and bad. You know, it's not always fun. There's people out there that are not very nice, but it makes it worth it because you do get to feel like you're making a difference out there. Next slide is a little bit, you know, money isn't everything, but I talked to Mr. Foncio about putting this in here because it should influence a little bit your decision. You want to like what you do. I've seen pharmacists that get done that absolutely hate it. They can't deal with the pressure and have gotten out of the field completely. But all the time and effort that you put into school and that stress, you do get rewarded for it. A couple other reasons: healthcare industry provides job security. It's ever growing. Pharmacy jobs keep going up. Business Insider said it's going to grow by 14% through the year 2022. Like I said, we talked about the role of pharmacists expanding. Prescribing is going to come very soon for basic things like blood pressure and stuff. The reason I put Kansas as a great place, KU is the only pharmacy school in Kansas. So good and bad. Other states, especially along the coast, have saturated their coast with pharmacy schools. So they're putting out too many pharmacists, and they can't keep up. In Kansas is one of the top 3 states, I think, in the United States as far as getting a job as a pharmacist because we only have that one school. They've done a good job. They have room for about 170 kids, 150 on main campus, 20 at the Wichita campus that they opened. They will not fill all those. Most classes have about 140, 150 because they have 300 applicants. They go through and say, if we have 170, great. Sure, if we have 140, we're only going to fill 140. So just because there's room doesn't necessarily mean you get in. And that's why Kansas has kept that good job market like they have.
Hey Mike, how competitive was it to get in for you?
It's very competitive. I'll talk about curriculum and stuff, but you need to start now in high school. Grades are important. Getting the scholarship, you need to look at curriculum. There's some high school classes that you can take now that's going to make it a little easier on you later, and we'll talk about that. But it's very competitive. I think my class had about 300 applicants, and a lot of my class were people that didn't get in the first year or even second year, and it's the third year that you get in. So it is very competitive. Once you get into college, you really have to kick in gear. You have your grades through college matter a whole lot more than pretty much anything else. They'll tell you in your interview. You have to take a PCAT, which is like the MCAT, before you go to pharmacy school to test where you are. And they say out of your application, if there's one low point, that needs to be the low point. They'd rather you have a 3.8 GPA than score 80-something on the PCAT. So very important once you get into college. You need pretty much all A's. You can get by with some B's, but that's how competitive it is to really get in. So for me, going from high school to JUCO to KU to pharmacy school, every level was a little bit of a step up. In high school, I was not a very good student. I didn't study very much like I should have. But you get into college, and I thought when I went to JUCO, I was like, oh, I had to study 2 or 3 hours for a test. That's a ton. I'll never have to study more than that. Then you go to KU and you have 900 kids in your organic chemistry class, and you're studying 7, 8 hours for a test. I'm never going to have to study more than that. I will tell you, and I don't tell many people this because it's embarrassing, the only test that I've failed in my whole life was my very first test of pharmacy school. I studied, it was a medicinal chemistry class. I studied for about 9, 10 hours. Thought that was really good because I got by organic chemistry 7, 8. I went and got a 56%, and I was thinking, am I going to make it to pharmacy school? The study level bumps everywhere you go, and you think you can't do it, and it just becomes routine. You know, you start studying more often for longer periods of time, and it gets okay. But it definitely is important once you start into college not to have those off classes, because you know a couple C's, you can get away with it, but it might delay you a year from getting in, because they'll want you to take those classes over and show them that you can get those grades. Financial security, another reason. Top 10 best paying jobs in 2014, surgeon, physician, psychiatrist, orthodontist, pharmacist made the list. So that is something to look into. Cost of school is very, very high. Stay in state, which I highly recommend if you're going to go, because out of state is about double. It keeps going up. You're looking at, once you get into pharmacy school, about $25,000 a year. So very expensive, but as you can see, if you look at it as an investment, it pays off when you're done. Okay, so it's crazy, and there's all kinds of help, all kinds of scholarships, student loans, everything. But it will pay off when you're done. It's kind of makes you want to throw up a little bit when you're doing it, but it's worth it. And that one I put on there because if you do go to KU, it's a very, very fun place to be. My first 2 years there, I think I missed maybe 1 or 2 KU basketball games. We camped all week for them. It was a lot of fun. I don't know if you guys remember the Missouri game, the last Missouri game over at Allen Fieldhouse. We were down by 19 in the second half. I was 5 or 6 rows behind the KU bench, and I told my buddy, if we go down by 20, we're leaving. And they came back and won. And so I'm glad they didn't go back down by 20. But pharmacy school is, like I said, don't be intimidated by what I'm saying. If you would have told me when I was sitting in your seats, you know, all the studying you have to do and everything, I would have been intimidated, said there's no way that I can study that much. But you get to each level and it becomes a lot easier. So I was telling Mr. Bonesteel before this, I'm missing the slide. Okay, well, if anybody needs the curriculum, I do have the curriculum printed out. The reason I say that is important is you get to college and you rely on your advisors. Take their advice, listen to what they're saying, make sure you're doing your own homework. There's a lot of people in my class that were first-time acceptees, but years behind because their advisor didn't know exactly what courses. It's very specific. Your science courses are laid out perfectly for you. It's easy to enroll, and they have a specific curriculum that you have to take. You missed 1 chemistry class, you're a year behind. So make sure if you want to go into pharmacy that you look up the curriculum, get a hold of me, I can get it for you. It's on KU's website, it's pretty easy. Also in high school, physics, you take physics, you get an A or B, you don't have to take college physics. So it's very worth it to do that. I was telling Fonsteel before I came in here that my toughest class in high school was by Mr. Parsons. Senior year, I think there was 4 of us in there as advanced calc. And he told me, and I, being a ignorant high schooler, no offense, I kind of laughed. He said, this will be harder than your college calc class. And I struggled a little bit with it, and it was way harder than college calc. But he said at the beginning of the class, you will hate me this year, and you will love me next year. And that is true, because college calc is a lot easier because of that class. So it's definitely something you want to be prepared for. I also wanted to say that a lot of people say, and it's somewhat true, that your first 2 years of college, everybody takes the same classes. You don't really need to have a major picked out. But that's somewhat true, but a lot of majors have specific, especially if you go into healthcare, specific things that you have to take. So I always try to tell people when they ask me, pick, and you can always change later. So pick what you're going into when you go into college, and you can always change it. I know people that have changed their major 3 or 4 times. But you want to take all the gen eds, but at least be going in a direction would be my advice for you. And then you can change it later. That way you don't find yourself behind on some stuff. Any questions about pharmacy, about pharmacy school, about jumping from high school, JUCO, KU, pharmacy school? Yes?
This is more of a personal question, but how has the Obamacare Act affected your profession?
That's a good question. Not to be politically correct here. Affordable Care Act. There is a lot of controversy over that. We're seeing a lot of premiums going up a lot. I don't know how to fix it. I don't necessarily, in my opinion, think the Affordable Care Act was the best way. Insurances are starting to, smaller insurance companies are starting to drop out, be consolidated into bigger insurance companies, so then you only have 3 or 4 big insurance companies. And as a result of that, they will dictate how much they pay the pharmacy, which will dictate how much you get charged. So pharmacy, we talk about owning your own pharmacy, which is definitely an option. 10 to 20 years ago, the average margin on a prescription was the pharmacy might make 10% of what you get. People complain all the time, oh, the pharmacy's just making so much money. I bet you 20% of the drugs that go out of my pharmacy, we actually lose money on. And it's because insurance companies say, we're only paying you this much, and you have to sign our contract saying that you'll take this insurance, and we lose money on it. So the average margin now is 2% per prescription. So if you want to go into independent pharmacy, it's a little bit scarier than what it used to be. You got to find other ways to make the money. But the Affordable Care Act, I think, has consolidated insurance companies, and it is a proven fact that premiums for elderly, especially, have gone up because of it. So I don't have the answer. That's way above my head. I don't have to fix it, but that's my opinion on that. Anybody else? No? Yes.
Sorry for going again, but what do you think of CBD in the pharmacy industry?
CBD. So you're gonna have to tell me what CBD is.
Cannabis.
What?
Cannabis.
Oh. I don't know. I have very mixed feelings about it. That's probably all I'll say about it. Anybody else?
Mike, is it too personal to ask how much you went in debt to get your degree?
No. I wouldn't recommend doing it the way that I did it because it's very hard, but Mrs. Ryan had to put up with me. I worked full-time all the way through school because I was trying to get out with as little of debt as possible. With me working full-time, doing a year at JUCO, which was free, and taking out as little as possible, I got out, my goal was under 100, and I got out with like 98. Most people in my class were up around the 150 mark for everything, because you know, $25,000 a year, plus your undergrad, plus all your living expenses. Most people in my class, if they worked at all, they did like 10 to 15 hours, because it is a lot of studying. I kind of killed myself when I went through pharmacy school. I got up, I went to work, left work, went to class, went back to work till 9, then studied, and did it again the next day. I basically didn't have a social life. So I wouldn't say to do that. If I had to do it over again, I wouldn't do it that way. I try to have a little bit more fun, meet more people, but that's just the way that I did it, to try to help with that debt a little bit. But like I said, if you go talk to anybody that knows a whole lot about finances, even going